Yes, you mentioned the consideration of ethics of things like challenge studies. Have any human challenge studies for COVID-19 been conducted, or is it still just talk?
Okay, thank you. Volker Termeulen. You are muted, Volker.
Thank you, Joachim. I have a question to the first speaker, and this refers to the management of COVID-19 on this island. When the pandemic started, we were all surprised to see for such a whole long time your country could manage and keep the infections low, but then it was coming back. And I'm now surprised to see that only about 75% of the population are vaccinated. What is the reason that you don't have a higher percentage of vaccinated people, despite the fact that you have managed everything so well, that you may have, convinced the people, to behave properly, to keep all the distance which is needed, but still, obviously, you could not convince them to get immunized in a higher percentage. Maybe you can tell us that.
Okay. Well, I don't see other hands up. CJ, would you take the question and then back to Dr. Swaminathan?
Okay, I think that the reason for people in Taiwan to comply this pandemic prevention guideline is that we once have a very severe SARS outbreak, and people in Taiwan, they know that this it is really important for them to follow this government guideline, including this face mask or washing hands and immunization and so forth. And of course, you are right that in the island country, the border control is also very important. So I think that we do have our own border control policy, and as well as we have very good people in Taiwan, they're following this government guideline very well. I think this kind of good citizenship is very important.
Now, my question was actually, what is the percentage of those who object being immunized? This is what the problem we have in Europe so much. Why people are rejecting despite the fact that we have all evidence, they are objecting. What is the reason on your island?
So far, that's we still are vaccinating the people. And according to this survey, and we found around 5% of the people refuse, they don't want to be vaccinated, only 5%.
Only 5%.
Yeah.
Dr. Swaminathan?
Yes, thank you for that question on the human challenge studies. So there are human challenge studies going on. Obviously, during the first phase, it was more about standardizing the dose and the strain, etc. So that itself takes several months, and then you have to have a very standardized way of being able to deliver a challenge. So we were discussing with groups in the UK, in the Netherlands, as well as the NIH, for example, on how some of these studies would be done, and our ethical framework that was developed by the bioethics working group really laid out the considerations, not that it should or should not be done. With better treatments becoming available, there then was more confidence that these things actually can be done ethically, because even though you do it in young people with a very low risk of disease, we know that there are occasional young people who become severely ill. So having a treatment was actually one of the considerations for going ahead. So I don't have the details of the studies, but I do know that there are a few centers in Europe that were going ahead with human challenge studies. I can find out more.
Thank you. Chancellor Marcelo, take the mic to you.
I want to ask to Chan that I see that he is in his speech very interesting about the origin of the virus. So what is your hypothesis about the origin of the virus? You understand my question?
Please repeat it again.
So I see that you are interested in know what is the origin of the virus. So I ask to you, what is your hypothesis about the origin of the virus?
Device.
What hypothesis would you formulate about the origin of the virus?
Oh, okay, good.
The source of it.
Okay,
Well,
wow.
it was a cautiously formulated question.
Okay, I think this the origin of this the virus is not clear now. But WHO have sent delegations to do investigation. Unfortunately, they did not have a very conclusive one. And there are two possibilities. One is that the spillover. It means that from one species jump to another. That's naturally, but we have to identify what is this intermediate host to transmit the virus from the bats to human. That there are intermediate hosts, but we had not been identified. And the second thing is that there might be something associated with the laboratory working and some of the leakage. And so far, the data were not available, and so I think this it deserves a further investigation. And World Health Organization is trying its best to carry out, to send another delegation to do the investigation. That's the reason why I said that we really would like to see that there's the cooperation of China. I think transparency and openness is the best way to examine the origin of the virus.
Okay, thank you very much. Let me thank the two speakers again. Our statement at the previous conference a year ago, Dr. Swaminathan, was a strong support of WHO for WHO to be equipped with the necessary resources to deal with the pandemic at the time when one important country had dropped out from the membership of the WHO. We hope that the resource base of WHO has significantly increased and improved over the time recently.